Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
You know that feeling when you're seriously out of breath and you just can't figure out why? It's a really common thing, but it can also be a sign of something much more serious. That feeling, it's actually called dyspnea, and it's one of medicine's great mysteries. So in this explainer, we're going to unravel why this one symptom is so incredibly complex and how a totally new approach is changing the whole game. All right, let's get into it.
Right off the bat, this is the most important thing you need to grasp. Shortness of breath, that's not the actual problem. Think of it more like your body's emergency alarm system, just screaming that something, somewhere, is going wrong. It could be your heart, it could be your lungs, it could be a mix of things. And the real challenge is just figuring out what's triggering that alarm. And believe me, this is an alarm you really need to take seriously. We have real-world data from Europe showing that for patients who show up in the ER because of dyspnea, the 5-year mortality rate is over 25%. That is just a shockingly high number, and it really drives home how critical it is to get to the root cause, and fast.
Okay, so why is this alarm so hard to figure out? I mean, if your body is sending such a clear signal, why do doctors struggle to find the source? Well, the answer lies in this incredible and kind of confusing overlap between our two most vital systems. This lays out the central problem perfectly. A patient comes in, they feel breathless. So is it their heart or is it their lungs? You can see the list of potential culprits is long on both sides, from heart failure to COPD, and there's no single easy sign that can reliably tell them apart. It's a genuine diagnostic dilemma. And to make things even trickier, you've got these hidden culprits, like this one, HFpEF. It's a type of heart failure where the heart's actual pumping function looks totally normal on all the standard tests. The issue is that the heart muscle is too stiff to relax and fill up with blood properly, but because it's still pumping just fine, it can get missed so easily. It is a huge, and I mean huge, reason why so many people suffer from what they call unexplained shortness of breath. So when a patient shows up with this alarm signal blaring, what's the typical first response? Okay, let's walk through the standard diagnostic journey that most doctors are going to follow. This flowchart you're looking at is basically the roadmap for that journey. When someone comes in with unexplained dyspnea, doctors kick off a clinical evaluation. They're reviewing your chart, your history, and then they move on to a whole series of foundational tests to try and narrow down the possibilities. So let's break that map down a bit. The initial investigation really boils down to these 4 key steps. They'll run blood work, right, looking for signs of heart failure or maybe anemia. They'll do an ECG to check the heart's electrical rhythm. They'll use an ultrasound, an echocardiogram to actually look at the heart's structure and how well it's pumping. And then finally, they'll do lung function tests to see if the lungs are the problem. But here is the crucial turning point. What happens when all of those tests come back and the doctor basically says, well, everything looks pretty normal? The patient is still breathless, that alarm is still going off, but the standard investigation has just hit a complete dead end. This is what the source material calls an unsatisfactory explanation. And that dead end, that is exactly where our hero enters the story. It's a new, specialized model of care that's designed specifically to solve these really complex cases, the dyspnea clinic. And here's the best way to think about it. We all get why a specialized chest pain unit is so important for a potential heart attack, right? It brings together the right experts and the right tools for a really fast, focused diagnosis. Well, dyspnea clinics do the exact same thing, but for this incredibly complex puzzle of shortness of breath. Now, this slide highlights the fundamental flaw in that standard journey we just looked at. Almost all of those initial tests, the ECG, the echo, the blood work, they're all done while the patient is just sitting there at rest. The problem is, many of these hidden conditions only, and I mean only, reveal themselves when the body is actually under stress. This is the game changer. The dyspnea clinic uses advanced tools like cardiopulmonary exercise testing, or CPET. They basically have the patient exercise on a bike or a treadmill while they're being closely monitored. And this lets doctors see how the heart, lungs, and muscles all work together under stress. And that is how they unmask those hidden culprits like HFpEF, pulmonary hypertension, and other issues that are just completely invisible when you're resting. But, you know, this whole thing builds into something even bigger. It's not just about a new test or a new clinic. The dyspnea clinic really represents a fundamental shift in how we approach medicine, moving away from just looking at isolated organs and instead looking at the complex pathways that connect them all.
This approach, it's got to be a team sport. It's just not going to work any other way. It's not a cardiologist or a pulmonologist working in their own little silo. No, it's an integrated team. Cardiologists, pulmonologists, imaging specialists, and exercise physiologists, all working together, sharing what they find to solve one single patient's problem.
So let's wrap this up. What's the big take-home message here? First, remember dyspnea is a serious alarm signal. Second, figuring it out is really tough because the heart and lungs are so deeply connected. The Dyspnea Clinic is the solution, a true systems-level intervention that brings a whole team of experts together to find that root cause. And ultimately, it's saving lives and improving outcomes.
And that leaves us with a really fascinating final thought to chew on. As medicine gets more and more complex, maybe the biggest breakthroughs won't come from just focusing on a single organ, but from creating these integrated teams and pathways to solve the body's most challenging alarm signals. Really makes you think, doesn't it?